Good evening, everyone. Welcome to our virtual hangout.
Good evening, everybody. Here
Oh,
we
we're
are
so
in
excited you're
November.
here. I
I know.
know. Oh my gosh. And Sue, it's hard to believe this is actually our second education event of the month already, and we're only 6 days in. So
Ah,
talk about a busy
yes,
month.
yes. And we're all preparing here at Unite for Her. If you're familiar with a lot of our events, we have our chef event coming up tomorrow. So we were
Yes.
very busy setting up the Phoenixville Foundry, and we are very excited to host our community that can join us. All uniting to actually help Unite for Her move forward in such a positive way and serve more and more across the nation. Yeah.
Yeah, we are so excited. So hopefully some of you that will be joining us today, we will see you tomorrow evening. But if not, keep it on your calendars for next year. It's always this time of year. So we would love to see you.
Absolutely, absolutely. And then just, a little bit of housekeeping. All of you know Zoom by now. You're all experts, but we always like to just make sure you know that, hey, we have a wonderful forum here where you can raise your hand if it's a small group, or you can unmute or put it in the chat. So we'll be asking questions at the end and really leaving time. But if there's something in between, put it in the chat and Erin and I will get to it for sure. That way we can ask Dr. Ellis directly and get your answers for her. This is recorded. That is very important that we have this option for our thousands of members that are in the Unite for Our community so they can go through and really look at the topics that are meaningful for them. So everything that we have tonight will be recorded, as well as any documents that Dr. Ellis is sharing with us in the chat.
Yeah, wonderful. And we know that this is not always the most comfortable topic, although hopefully tonight Dr. Ellis will give us all a little bit more empowerment to feel good having some uncomfortable conversations. So know that although we are recording, really we will just see Dr. Ellis. So we encourage you to take your cameras off and really engage and ask questions. We truly have an expert here with us tonight, so we're so excited to have her.
Yeah, you got it, Erin.
Um,
Yeah,
yeah,
for
and
sure.
I will share a little bit of a reminder because, like I said, while we're just 6 days in, we're two events in, and we have another one coming to us tomorrow. So, little reminder: we have our second Ask the Experts of the month tomorrow, Thursday. Sue will be hosting this, streaming live on Facebook at 12 noon Eastern time. So tune in because we will be joined by Tiara Neal and Dr. Monique Gary. Many of you know and love her, to talk about the BEXA breast exams and the work of the BEXA Equity Alliance. So they do a lot of work to bring breast imaging as part of comprehensive care to communities and to women across the country. So she will be chatting with them to learn a little bit more about what they do and what their alliance does. So we'll put in the chat. You can, as always, with our Ask the Experts, submit your own questions. That will also be recorded and in our library. But know again that you can just join us tomorrow at noon on our
Live.
Facebook page.
Yeah. Yeah. And then you just submit your questions to unitefor.org/experts. And then
Yes,
we'll be watching those. We'll make sure we get through them all. Yeah, I'm
wonderful.
very excited about that one as well. Loving the
Me
way
too.
that technology is just giving us more and more tools so that we can be
Yeah,
better advocates for ourselves. Yeah.
absolutely.
Yeah. All right, Erin, shall we bring on Dr. Ellis? Are we ready?
Yeah, well, do we want to give a quick thanks to our sponsors?
We absolutely do. Thank you, Erin. So we can't do what we do without them. We have over 40 of these speaker series, Ask the Experts, virtual hangouts. And these education series, we actually have this wonderful channel that we bring to our community. It is community, and we can't do it without our supporting sponsors and presenting sponsors. So a huge shout out to our presenting sponsors, West, Merck, and Daiichi Sankyo, and then our supporting sponsors, GSK, Lilly, Gilead, Pfizer, and Immunogen, which is now owned and a part of AbbVie. So thank you so much for all of your trust, support, and obviously allowing us to bring such incredible topics like we have here tonight with Dr. Ellis.
Wonderful. Okay. All right. Now I think we can really get started.
I agree. I agree. Shall we
Wonderful.
hear
So,
Dr. Ellis?
yeah. So we're, like I said, we are so excited to have Dr. Ellis with us tonight. So, who is she? I love this. She is a pleasure advocate and enthusiast. I was like, say no more. yes, let's have her with us. But also, she's an occupational therapist and an American Association of Sexuality educator, as well as a certified sexuality counselor running a private practice in Wilmington, Delaware. She started the military's first occupational therapy, sexuality, and intimacy clinic at the Walter Reed National Military Medical Center, where she worked for 10 years. Dr. Ellis is also an author, a speaker, a consultant on all things sex, intimacy, and pleasure. She absolutely loves working with women to help them strengthen their relationship with their bodies, their desire, and their pleasure, because good sex makes for empowered women. So please join us in welcoming our amazing guest tonight, Dr. Kathryn Ellis.
Amazing. Thank you so much. Hi, everybody. Good evening. It's so exciting for me to be here, and we are going to have a lot of fun tonight. We are going to be talking about body image and sexual health post-cancer diagnosis. So I want to start us off with this quote, kind of centering what we're doing here tonight. This is an amazing quote from Adrienne Maree Brown. And Adrienne reminds us that desire and pleasure are two ways that we assert that there is something worth living for. And what can often happen with a cancer diagnosis or just constantly being in the healthcare setting is that what sex and pleasure can really be deprioritized. I'm an occupational therapist. I'm a provider myself. And we oftentimes providers are the biggest culprit here, right? Because they might say, well, oh, don't they have so many other things to be worried about? And really what's happening is the provider is making that choice for you. And for anyone who's gone in and out of the healthcare setting and in and out of this experience without a provider discussing sex and sexual health, I want to say that I am sorry that you had that experience. Unfortunately, it is really common. And what I also want to say is that you are a sexual being, and I see you that way. And so does Sue and Erin and Unite for Her, and that's why they prioritized this event. And so, in this workshop, today it's going to be a bit of a workshop. You're going to be guided through some guided some self-reflection questions to kind of meet yourself where you're at as you navigate these challenges of body image and sex and communication. Cancer treatment can really shift how you feel mentally about your body, but it can also shift and change how you feel physically in your body. We know that there can be a lot of changes like hair loss, weight gain, weight loss, and then also just like experiencing physical pain in the body. And I always say that pleasure and sex are things that we experience. They are things that we feel in our bodies. And so nurturing positive feelings about our bodies and relearning how to feel pleasure in the body after, what is frequently a very painful experience in the body is so important, yet it is often a very overlooked aspect of that healing and that recovery. So, I love Adrienne Maree Brown's quote, right? We all can probably agree, but it still might feel like a bridge too far, right? And I just want to meet you where you're at with that. After this workshop, you probably won't be totally rid of body image issues or ready to just jump right into the bed and have sex. But what we really want is for you to have some ideas on how to view yourself and honor yourself as a sexual person. Getting a better sense of where you're at and just considering coming away with one idea that moves us a little closer to feeling pleasure in our bodies or having sex, and kind of a clear idea of what's even the smallest step forward there. A bit of an agenda. So first, this is going to be like a workshop, right? So I should have said this in the very beginning, but if you can grab a pen and paper, we are going to be doing some journaling exercises. So you've got a little bit of time to grab your pen and paper, but definitely grab it now. So we are going to be talking about just like, where am I at, right? Like maybe you haven't given it much thought, or maybe a little bit, and that's why you're here on the call. So then we're going to do some art exercises, and then some touch exercises, actually. So getting in touch with yourself. And first here, I'll share with you a little bit about me. So as Erin mentioned, I worked at Walter Reed for 10 years, and it was there that I started talking to my patients about sex. And I was a regular acute care therapist, and it was 2011, and we had mostly combat injured service members. So I was mostly working with, it was typically young men who had had dramatic changes to their bodies. Many were amputees or spinal cord injury patients. And that's where I started. And then it quickly grew from there. Walter Reed is a huge hospital. So I was able to work with tons of different folks that had different, diagnosis and treatment going on. So I worked with folks that were going through cancer treatment, people that had pain with penetration, postpartum women, people that didn't have any physical issue going on, but they just felt like they had low desire, erectile dysfunction. And, it was really, after speaking to so many people, I just really noticed that so many of the issues and the challenges that show up in sex are very, very similar. It's not sure how to adjust to the body that you're in, whether your body is different now or your body has gone through changes, a difficulty adjusting to that. Having sex look different felt really difficult. Then communicating about that felt really difficult. Tons of body image, that, it's interesting, I would have two people in the couple, and there would be like the person that was going through cancer treatment and then their partner, and they both had, issues. Everyone had issues with body image. It came up in almost every session. So I always like to say that the number one issue or the number one diagnosis that I work with is bad sex ed. Okay. So a lot of these challenges, I just like to be empathetic with everybody, right? Like, so we didn't have a great sex ed that taught us, that sex can look a lot of different ways, and taught us how to communicate about sex, taught us to feel positively about our bodies. And so I just always would see a lot of similarities there. All right, so let's start to think about you a little bit. So as we think about sex and body image, it's helpful to just kind of say, like, well, where am I at with things? Okay. So our first self-reflection here is just meeting yourself where you're at. Think about, what do you tell yourself about your body? And what do you tell yourself about sex? And if nothing comes up, then that's totally normal. So we're just kind of thinking about, when you think about sex, what do you think about? What comes up for you? And then when you think about your body, what do you tell yourself? So we're going to take about 2 minutes on that. And take your time with this, but I want to offer a couple options for sharing. So we have the option for you to message me directly. So you go into the chat and where it says to, and it says to everybody. So you would scroll down to Kathryn Ellis. So you have the opportunity to anonymously share whatever you want to share with me, right? So we'd love to hear, or you can come off mute and talk. You can send it to the group, the entire group. But I would really love to hear what some people are reflecting on and what some people are saying, because we can really learn from each other. And so I always recommend that option to DM me, just me. But it's really amazing that we can then, I would then like share that and help people see, oh, okay, I'm not the only one that feels this way. And it's amazing when we can learn from each other. Okay, someone is sharing, nobody wants to see this. Thank you for sharing that. Yeah, kind of a feeling that sex will never be the same again. I've heard, I just did this with another group of breast cancer survivors, and they shared, it was a whole range of things. Some people said, my body is a miracle for getting me through this. But I also feel that my body is no longer desirable. What do you tell yourself about sex? Like when you're thinking about sex, what comes to mind? Okay. Amazing. Thank you everyone for sharing. All right, so we've got someone who shared, I don't like my body anymore. Before my first surgery, I finally gotten my body the way I wanted. Now I have 4 small scars and 1 very big scar now. Sex is nowhere near what it was before, and my libido is so low. Yeah, so just getting, a difficult time getting used to the new body. Someone shared with me directly, I have no feeling and sensation. I want to be intimate with my husband, but I have no libido and can't climax since tamoxifen. Okay. All right. Thank you, everybody. Okay, we've got more. Amazing. I'm actually loving my body right now. I've lost a lot of weight intentionally, and I'm feeling better about myself than I have in a long time. I avoided sex when I was in a larger body because of my insecurities. After a long time without sex in my relationship, I feel very awkward initiating again. And my husband has seemed to have given up on me being interested. So there can often be a kind of awkwardness that happens if it's been a while, if there's a break with sex. Okay, amazing. Thank you, everyone. All right, let's go on to our next concept, okay? So I hear body discussions about body image all the time. And it always, I have observed, right, that like there's this like small standard of beauty. But it also feels like a moving target, right? Like it feels never enough. And like there's always something, right? To make us feel like self-conscious and I also hear that the body image is the barrier to being sexual, right? Or the barrier to really enjoying the sex. And I like to challenge or just offer a reframe that kind of acknowledges that pleasure and body image, just like an obvious statement that they are in two separate swim lanes, right? So body image is this cognitive thing that we do where we step out of our bodies and assess our bodies. Whereas pleasure is something that we feel in our body and process in our brain. So they're two totally different systems. And I also think about sex as, but again, with that body image, right? It's like the standard of in order for me to deserve sex, I have to look a certain way. And I really, really challenge that. Obviously challenging that doesn't happen overnight. It's not like, but it's just trying to think about like, where can your reframes be? And I just love this phrase, pleasure has no standard of entry. So pleasure is a birthright. Our bodies were designed to feel pleasure. It's why when we eat a brownie, it tastes really, really good. And why when we touch velvet or silk, we like the way that it feels. Our body was built to feel pleasure. And there's no ticket of admission, right? There's no admission ticket to get into that. So this is a pretty philosophical thought. It can be kind of new, different. So I just ask out of curious, kind of for you to be curious, like what are your reflections to that? Pleasure has no standard of entry. So just think about it. When you're ready to share, write it down. Even if your reflection is like, Kathryn, this sounds like a great, concept, but I'm just not there. I don't feel it. But any reflections that you're having from it. Yeah. The statement, like understanding the statement on an intellectual level, but on a physical or emotional level, it feels harder. Yeah. All right. Well, keep thinking about that. The goal today, right, is really you journaling. Okay. So that's the main important piece, and then sharing it is secondary. So keep thinking about that. All right, here is our next question. So we're shifting from body image into pleasure here, okay? What ways have you brought pleasure into your body, either during or post cancer treatment? What do you do that allows you to feel pleasure in your body since your diagnosis, since your treatment? Let's just start, if we're talking about, feeling pleasure and sexual pleasure, let's just start with like, that umbrella of pleasure, the big umbrella of pleasure. I always like a hot shower, silk pajamas, Tea. I love drinking tea, like herbal tea, bubble bath, massages, warm shower, fluffy blankets. Yeah. Fuzzy blankets. Yeah. Walk outside at night in the moonlight. I'm thinking too, just like the temperature feeling nice as well there on your skin. Fluffy socks. Yeah. Great. Okay. Yeah, especially when I'm having hot flashes. Yeah. Okay. This is a bit of a harder question. So this is let me tell you where this question is coming from. So a lot of times I'll talk with couples and one of them, typically the woman will say things like, well, I want more romance or I want to feel more connected. And then I'll go, okay, well, what can he do, right? What can he like literally do to make you feel romance? And she'll be like, well, romance. And he should know. It's been 10 years. And I promise you, when men hear romance, they think like, okay, I have to come in on like a white horse and have like roses. And it's like, then the wife is like, you don't even ride horses. Like, what are you talking about? That's not what I'm talking about. So that's examples, like that's like a heterosexual couple. But regardless, right? Like a lot of couples, one person wants a sort of philosophical thing, and then we're not able to explain what that looks like. So if you think about, so I'll say, okay, romance, like, well, what does that look like? And someone might say, that looks like eye contact to me. Or another person might say, that looks like asking me how my day was at the end of the day. Or another person might say, that's bringing me a glass of wine every day. So we all have different definitions, and we have different definitions from our partners too. So thinking about, we want to first, like, whatever you want to feel in your body, we need to get you that, right? So the question is, what do you want to feel in your body? Do you want to feel closeness, softness, calm? And then ask yourself, okay, what can I do? Or what can my partner do in order to help me feel this way? So what do you want to feel in your body? And then what does that look like in an action? And if you don't know, if you can't come up with something, like if you don't know what you want to feel in your body, take the inverse and say, how do I not want to feel in my body? So when you take the inverse, when you ask yourself, how do I not want to feel? That can sometimes help you get at, how do I want to feel? So maybe you say, how do I not want to feel? Okay, I don't want to feel rushed. I don't want to feel okay, so if you don't want to feel rushed, then you want to feel calm, relaxed, beholden, cherished. Maybe you don't want to feel pain, okay? So you want to feel, again, that relaxation. So someone is sharing, I miss the intimacy and connection. And for them, that is kisses, hugs in bed, and in everyday situations can meet that need for connection. Okay, wonderful. All right. So shifting gears actually a little bit back to body image. Okay. So these are some art exercises here. So on your piece of paper, I want everybody to draw like a stick figure. And what you're doing here, oftentimes I find that that body neutrality, especially when it comes to body image, right? Like a body neutrality feels a little bit easier than body positivity, right? This idea that I like have to feel positively about my body, or else I'm not doing good enough job at being a human. Whereas um, body neutrality acknowledges that like my worth is not tied up in my body at all, and that my body is really a vessel that carries me around. So it's more of a neutral feeling towards it. And so when we think of the body, like what are we thinking of as objective things about your body that you're grateful for? So thinking maybe, I'm grateful for my soft stomach because it stored fat to sustain me when my appetite was very low during treatment. I love my arms for being able to give hugs. I have my nose for smelling. So just thinking about your body. I mean, another thing we do is we focus so much on our body as, is it desirable? Is it not? And it serves us in so many ways throughout the day that we often don't think about. So what's coming up for people when they think like, okay, what is the thing I'm grateful for about my body? Okay, so someone is sharing, I'm grateful for my tummy during Zoladex injections. Yeah. Okay. So our next question, we started from a place of body neutrality. Our next reflection is not to be confused with body positivity. Okay. Body positivity is like, I have to like my body. Okay. Oftentimes when we think about, the standard of beauty or how I have to look when I'm having sex, is we're thinking about somebody else looking at us. Okay. So we're thinking about somebody else finding us attractive or somebody else finding us sexual. All right. But the reality is that we can sexualize ourselves. We get to choose that. And it's actually a much more empowered place when we say things like, okay, this is why I am sexy, not how you're telling me I'm sexy, but this is why I am sexy. Or sexual or powerful, right? If sexy and sexual doesn't hit, then try powerful. So again, with your stick figure, okay, going through and circling, different areas of your body that you are saying, this is what makes me feel like a sexual person. And it has to be the way your body is now, not like 20 years ago, I loved my legs. So I've heard a lot of women say things like my eyes, um, remind me that I'm sexy and powerful, my shoulders. Some people will go like, come to think about it, I never really cared about my breasts. I love the way my legs look. So what's coming up for people? What are people thinking about? Again, you can always DM me directly. That's always an option for you. And if it feels hard, definitely share what feels hard about this question. I like my hands and my smile. The shape of my breasts, yep. But the hard part is the lack of nipples. Okay, great. Awesome. Okay, so shifting gears back into the body. So hopefully you've got a little bit of reframing of how to think about you and your body image. And I really am the biggest fan of trying to disconnect it from sex, right? Like acknowledging like, well, who said these standards anyway, right? Like who said that who said that bodies have to be symmetrical in order to have sex? Well, it's probably because in Hollywood we don't see any imagery of asymmetrical bodies having sex. So it might not be, it is, what I will tell you is it is not because you shouldn't have sex or you can't, right? It's oftentimes it's more that we've just not seen it. And that's, the imaging that we see in marketing and Hollywood. So now let's kind of work on some somatic exercises. And if there is anyone who has their partner with them, all your screens are off. if anyone has a partner next to them, then have your partner do this to you, okay? But what all you're doing is, there's a typo there. So you're rubbing your forearm, okay? So there is 1,000 ways to touch somebody, okay? And oftentimes we get hung up on, well, he touched me there or she touched me there and I didn't like it, or it tickled, or after my treatment, I'm so sensitive now. Or even some partners, right, will say, I don't know how to touch her without hurting her. Okay. So there's a lot of, and sex is touch. Sex is touch and touch is pleasure. Okay. So, and what ideally we're getting at is you trying to think about ways that you can feel pleasure in your body that doesn't necessarily have to look like the way that you used to have sex. Okay. But at least it is, or not at least, but like, you know, the being pleasure forward is saying, okay, that's the most important thing, is like, what's going to feel pleasurable right now? Not like, oh, I have to go back to the same exact sex that I used to have. I really mean that. No, it's not like a, because I said earlier, or just said like, at least you can feel pleasure in your forearm. That's not what I meant. There are many people that after treatment, after, you know, it opens up communication with their partners or after treatment or injury, and like they're having better sex than they ever had. And that's typically because they've had to really work through these challenges and communicate. Okay, so you are feeling the feels. I tell this to my clients all the time. Touch is pleasure. We feel pleasure through touch, but when we get touch, we get in our heads. Is he doing it right? Am I going to like this? Am I going to get aroused? Is it going to hurt? Is he going to, is she going to touch that area that I don't like to be touched? We're right in our heads and we're not feeling what we're feeling. Okay. So I like to say, feel the feels. That's also a very neutral way to say it, because we don't, it's feel the feels isn't like, ooh, this should feel better. Why doesn't this feel better? You're just collecting data. Okay. So, practice, just on your forearm, kind of like a light pressure. You can even close your eyes, light pressure, deep pressure, long strokes, little fingertip circles. Do you want to do like a corkscrew around your whole forearm? Squeezes, fingertip strokes. So just close your eyes and do a couple of different things there. Obviously you do this enough, right? Or and you're going to start touching yourself the way that you want to be touched, because it's a closed loop system. Okay. When somebody else is touching us, it's an open loop system. Okay. So think to yourself, when kind of given carte blanche to touch myself, how am I touching myself? And identifying that. Like, as I'm doing it, it appears that I like these like fingertip touches. So throw that in the chat. Like, what did you learn? And then think about this question. Okay. So this is back to our stick figure body. This is our last exercise. So circle the areas of the body that you want to be touched or kissed, and specify which one, and detail how, using these directional terms or using some of the like realizations that you had in our last exercise of the ways that you like to be touched. And this, how you receive touch and what you find pleasurable can definitely change after treatment. The bodies change, the nerves change. So don't ever think like, there's this kind of idea of like, oh, my partner should know what I want. They don't. They don't unless you tell them. And as we go through life, we just change so much as sexual beings that we kind of always need to do like a check-in of like, well, what do I like now? And how do I communicate that to my partner? And also think about over your stick figure, certain areas that you don't want to be touched, just put an X over them. And the reason in a lecture about body image that I've chosen to talk about pleasure so much is because when we start to live in our bodies, we start to pay attention to the pleasure, and the body image matters much less. Okay. When we're living in our head, the body image matters much more. But pleasure is this amazing anchoring and grounding experience that kind of gets us to live in our bodies and pay attention to it. Okay. Now, remember, the pleasure that you advocate for and you ask for, it doesn't have to involve penetration. It doesn't have to involve anything that you really aren't interested in. Okay. So you can feel, just be very open to the things that feel pleasurable for you. And that's when we can focus on like centering that pleasure, then you get to choose where that is in your body. All right, so amazing. Thank you, everybody. Continue to consider those reflection questions and keep going back to your stick figures over the next couple days. Don't be surprised if tonight it felt like you didn't have a lot of answers for these things. Maybe you haven't thought about these things before. If these are all new questions to you, then yeah, they are going to be difficult to answer. But they're great. So circle back to them. And of course, now I want to open us up for a conversation and any questions that you have for me.
I'll say, Kathryn, um, is this also something as there's reflection? And I really think, these are really great questions, just really thought-provoking questions. To open up the conversation with someone's partner, is it
Yeah.
something that they could sort of think about and converse with, to use as sort of a
Yeah.
guide to have that discussion, what can often be a sort of difficult and awkward conversation to get started?
Yeah, absolutely. Especially like the exploration one, oh, that's not what I wanted to do. Hold on. Especially like this one, right? So like showing that to your partner. And then asking your partner to do one for them, right? So sometimes I think that with illness or injury, there can feel this like spotlight on you that can feel a little off-putting. And when you open it up for your partner to be like, well, what do you like? Where can I kiss you and where can I touch you that you enjoy? And a lot, don't underestimate that. A lot of couples aren't really sharing that information because it feels like they should just know that, right? Or they're not even like aware of that. So I like to start like very, very foundationally, kind of back to the basics almost of like talking about your body with your partner. And it could also, I think one of my favorite phrases or words is curious, to be curious, right? So a lot of the questions I asked are sort of like, well, what do you like and where don't you like it? And how, soft, rough, pinching, spanking, caressing, like, and the idea is to have a curiosity about it, right? So to have a curiosity of what sex could look like if it didn't involve penetration or if it didn't involve trying to make everybody orgasm. Whatever feels like the barrier, being curious if it could change with making sex look different. And so inviting your partner to also be curious as well with you can be really helpful.
Yeah, I love that. I love the use of that word curiosity. And I think like how you spoke earlier about just sort of reframing and sort of looking at this discussion as just, like you said, more of a from the angle of just being curious,
Yeah.
can even just perhaps make someone feel a little bit more open to having it.
Yeah, absolutely. Some questions are coming in the chat for
Good.
me. Yeah, so there's questions about, let me read the other question. Hold on. Okay. Okay. Yeah, that's tough. All right. So the first question is, for me, it's not about body image or pleasure. It's about having zero libido. So tonight's lecture was not about desire, but that is a huge, huge aspect of sex for many people, and specifically, especially after or during cancer treatment. So that genuinely, that is another hour lecture. So what I would say about desire is, we focus a lot, maybe we overemphasize like hormonal desire, like the desire that just kind of light switch, right? Like I'm doing the laundry and then like poof, poof, I desire it, right? Or my partner says like, do you want to go upstairs and have sex? And I'm like ready to go have desire just by him saying that. So that's kind of that spontaneous or that easy, quick desire, right? And then there's other desire that's very dependent on context, and needs to slowly build. So without knowing too much about what you're sharing, what I would say to everybody on the call is like asking yourself, when sex is initiated, if you don't want sex, then don't have sex. If you don't want sex, but you want to want it, that's a very different story. And you can say to yourself, okay, what would get me like one step closer to it? Would it be, I need to take a hot shower, or I need to relax in my body, have a glass of wine, have some tea, like laugh with my partner. Like you might just need more things to get you like that oomph to kind of, again, not get you to a point where you're like trying to be horny, trying to feel that horniness, because you might not get there, but at least getting you a place where you're like more and more like interested. But again, desire is a huge, huge aspect of this. So I really appreciate that question. Okay, the next question talks about orgasms. Okay, so this individual finds pleasure from sex penetration. However, they've always been able to have an orgasm before cancer. Okay, so do you mind clarifying with me if you used to have orgasms from penetration, or if you were having orgasms like from fingering or from oral. What I would, yeah, okay, got it. So the answer is from penetration. So what I would say about that, and also this person added too something that is really relevant, which is that their partner like measures their worth in her being or her being able to orgasm, and she's not able to. So that's really tough. What I would say is that like during the treatment, anatomy can change, nerves can change. That can also occur just going through life, right? Like just the natural aging process, our anatomy and our nerves can change. And so I would recommend attempting to have orgasms that are outside of penetration. They're a little bit easier to control. They're a little bit easier to finesse. You might not think that if you had orgasms during penetration for most of your life. But I would perhaps consider exploring other ways to orgasm, and then also thinking about like, what are you feeling? Is it feeling really numb? Is it really dulled sensation? And then I might suggest like a vibrator. Yeah, it's dulled. Okay. So trying to bring more intensity with a vibrator, direct stimulation of the clitoris. This is all like an attempt to have like a clitoral orgasm. And then just, making sure, of course, like see what happens if there's more foreplay or if you feel more relaxed going into it. That's what I would recommend without knowing too much, but I would be happy to chat with you more about that. I am a Unite for Her provider. So I'm in Wilmington, Delaware. I'm licensed in PA, Maryland, New Jersey, and of course, Delaware. So, I hadn't mentioned that, but they're very, very like important questions, and it can just be so beneficial to have somebody to chat with about it. And as I mentioned, I'm a Unite for Her provider, so like would love to do that. Hmm. So one more question here. Do we have time, Sue and Aaron? Okay. So, trying to get past the awkwardness of initiating, and it feeling staged. Yeah. So I would say two things on that in the minute we have left. One, I would say sex is awkward. Okay. Like I hear a lot of people talk about how, well, it's, it feels natural, right? So sex is actually a very awkward activity, right? Like it's awkward to do. It's like bodies rubbing together. It's awkward to talk about, right? So some of it is just like embracing the awkwardness. I don't know where we got off thinking that like it was supposed to not be awkward, but I think that has limited us more than it has helped us. Then I would say kind of doing that exercise of how do I want to feel, right? And so you would say, I want it to feel natural. Okay, whatever that means to you, but what does that look like in execution? So think back, 5 years ago or however many years ago, and say, what was going on that made it what I am calling natural? And if you can't think of anything, then think like, what is making it, what is specifically making it awkward, and then do the opposite of that. Got it. Spontaneity. Yeah. So then I would say try to, if spontaneity really does not work anymore, I would try to bring in remember back, because you're saying spontaneity, but again, that's kind of a philosophical term. So think about like, what were the actual actions that made it spontaneous. And even if you plan the sex, try to bring in a little bit of that into the planned sex. But that's a really great question, Karen. And again, I not knowing much, but would be happy to chat with you more about that.
Wonderful.
Thank
That's
you.
amazing.
Thanks
And yeah, thank you
having
for
me.
sharing that you're a provider as well. So for those that have squares for their wellness passport and live in the states in which Dr. Ellis works, you can connect with her. But like I said in the beginning, she has her own practice as well. So you can absolutely connect with her individually. Dr. Ellis, this was amazing. What a wonderful perspective and really thought-provoking questions that hopefully can help our Unite for Her members sort of think of things a little bit differently and help have these conversations with their partners.
Amazing.
I
Yeah, thank you
agree.
for having me.
I know, Dr. Ellis, it just takes time, right? And I'm just so grateful that you brought up some areas that even I forgot. Like we put so much emphasis on our breast, and
Mm,
I love my legs. I love my eyes. I love my, right? And we forget about that because of the space we're in as survivors, right? Because it's what we lost.
mhm.
And it was nice when I heard you say that. It was just so nice to go back to what makes you you, right? And just making one step at a time, because it is building these routines that are healthy and engaging, and figuring out what you love again,
Mm,
yeah. So it was great. It
Yeah,
was great. It was great. Thank you.
wonderful. You're
wonderful.
welcome.
Thank you.
Thanks for having me.
And Sue did pop the handout in the chat.
I did. Yep.
That is a great supportive sort of handout to go along with this conversation. Certainly look at it on your own. And as always, come back and rewatch these segments. I think just going back and re-listening and kind of reworking through the conversation, especially around a topic like this that is such a challenge for so many of our members, can be really helpful as well. So thank you to everyone for engaging, providing feedback, asking your questions. We know that this is not comfortable, but hopefully engaging with Dr. Ellis, gave you some things to think about. And like Sue said, hope that it will get better.
Yeah. And practice, right? Once you have the tools and you're like, right, okay, let me try that again, or think
Practice.
about it a little bit differently. And it's okay to practice. It's okay, right?
Yep.
Yeah. Thank you so much,
Absolutely.
Dr. Ellis. We appreciate you.
Wonderful.
Yeah.
Wonderful.
Well,
Well, another
Erin,
great
another
virtual
good
hangout,
session.
another great segment. Yeah.
Oh, and another one tomorrow. Be ready to
Oh,
go.
absolutely. So definitely don't forget to tune in tomorrow, Unite for Her's Facebook page, Thursday, 12 noon Eastern time. Sue will be chatting with Tiara Neal and the one and only Dr. Monique Gary about their work with BEXA Breast Imaging and the BEXA Equity Alliance. So submit your questions to us, tune in, engage with us live on Facebook as well. So it'll be a really great conversation leading into our Harvest Chef fundraiser tomorrow evening. So for those that are local, hopefully we will see you. But if not, we've got plenty more to come this month as well. So definitely continue to follow us on social media, check in on our newsletter. Lots of great topics coming to you, throughout the rest of the year, dare I say.
Yeah. And two, for Harvest tomorrow, we are going to be streaming a little bit of it live. So tune in.
Oh, love that.
Yeah.
Yeah, so fun.
So fun. I know. And our silent auctions are live too. There's a lot of good stuff. Ooh, that room was
Ooh,
packed. Yeah.
yeah, definitely. So
Yeah.
fun.
Very
Lots
good.
of good stuff. Lots of holiday shopping for others. Just throwing that out there.
It's true. That is
Good.
true. Yeah.
All
Well,
right.
thank you again to our sponsors, Erin. We can't do it without them. And it is just such an honor to host these sessions each and every month, really keeping these really good tools and resources front of mind to help our community just be really good self-advocates and gain that
Yeah.
confidence and control back. So a huge thank you to West and Daiichi Sankyo and Merck, and our additional support coming from GSK, Lilly, Gilead Sciences, Pfizer, and Immunogen, which is now part of AbbVie.
Wonderful.
All
Well, thank
right.
you so much. Thanks again to Dr. Ellis. Thank you all for engaging and being with us today. Everyone enjoy the rest of your night, and hopefully we will see you again tomorrow.
Yep. Good night, everybody.
Good night.